Do you have carpal tunnel? Let's make an educated guess. Disclaimer, this video is for educational purposes only and does not replace an official medical diagnosis. Quick background, carpal tunnel is compression of the median nerve, which runs from your neck, through your shoulder, down your upper arm, to your forearm, and to these three fingers specifically. We usually see the compression occurring at the wrist underneath a thick band of connective tissue called your flexor retinaculum. Carpal tunnel itself produces usually numbness, tingling, burning, and sometimes can even cause muscle function to start to shut down. These are 5 tests in healthcare that we use as clinicians to help diagnose and then create a treatment plan for carpal tunnel itself. The first test is called a Phalen's test. For this test, you want to place the back of your hands together and hold for 30 to 60 seconds. A positive test would be burning, numbness, or tingling in your wrist or fingers. The second test is called a carpal compression test. For this test, you want to find the center of the wrist right at the crease and apply pressure. You want to hold for 30 seconds. Same findings for a positive test: numbness, tingling, or burning at the wrist or the fingers. The third test is called a Tunnel sign. For this test, you want to go to the same region and repetitively tap. A positive finding would be tingling or an electrical shock sensation in your wrist or fingers. The fourth test is called a hands elevation test or a hands in the air test. Pretty simple. You want to hold your hands above your head for a duration of 2 minutes. If this elicits or exacerbates your symptoms, it's a positive finding. And the fifth test is called a flick sign. Essentially, if you're actively having symptoms and you start flicking your wrists like this and the symptoms start to alleviate, that's a positive finding. Out of those 5 tests, if you have 4 positive tests, there's a moderate likelihood that you have carpal tunnel. If you have 5 positive tests, there's a strong likelihood that you have carpal tunnel. As always, if you like content like this, follow for more PT without the boring lecture.